Hi, I'm the Kegel Queen. I'm a registered nurse and my name is Alyce Adams. Today's video blog will answer your question, what is pelvic organ prolapse? Millions of women suffer with pelvic organ prolapse and millions more are at risk. But very few women understand what prolapse really is. What is cystocele? What is rectocele? What does it mean that my uterus is prolapsed? What does pelvic organ prolapse mean for my health? What does it mean for my sex life? What's happening in your body when you have prolapse? When you feel that something's not right down there, what are you feeling? If your doctor has told you that you have prolapse, but you feel normal, what's going on? The word prolapse means that something in the body has moved out of its proper position. Pelvic organ prolapse means that one or more of your pelvic organs, your bladder, uterus, or rectum, has literally fallen out of its proper place in your body. Sometimes people describe prolapse as a fallen or dropped bladder, uterus, or rectum. Prolapse happens when your pelvic organs lose support. Your pelvic organs are supported in two ways. They're held up from the sides and the top by ligaments. The ligaments are like ropes and sheets attached to your pelvic organs, connecting them to each other and to other parts of your body to hold them in place. Your pelvic organs are also supported from behind and below by the bowl of muscle called the pelvic floor. This is the pelvic floor. Here's your pelvis, here's the pubic bone, here's the tailbone. This bowl of muscle in between here is the pelvic floor. If the ligaments or the pelvic floor or both are not doing their job of supporting the pelvic organs, pelvic organ prolapse is the result. The organs sit right in here. Your bladder, uterus, and rectum are all packed into this little space. This is life size here. They're just packed in there, and the pelvic floor helps to hold them in place. There are three types of pelvic organ prolapse because there are three pelvic organs that can be involved. Bladder prolapse is called cystocele. A prolapsed rectum is called rectocele. A prolapsed uterus is simply called a prolapsed uterus or uterine prolapse. A woman may have just one type of pelvic organ prolapse or more than one. With each type of prolapse, whether it's the bladder, rectum, or uterus that has prolapsed, the organ falls out of place and takes up space inside the vagina. With uterine prolapse, the cervix, or the neck of the uterus, is lower in the vagina than normal, or the uterus itself can descend into the vagina. With bladder prolapse or rectal prolapse, the bladder or rectum creates a bulge in the vagina, but the organ itself is covered by the vaginal wall. What does pelvic organ prolapse feel like? With all types of pelvic organ prolapse, women often describe a heavy, aching, sagging, or dragging feeling in the pelvis. Some women with more severe prolapse have the sensation of something coming out of the vagina, or they feel like they're sitting on something. If you have a cystocele, prolapsed bladder, you might have trouble emptying your bladder completely. Try shifting your position on the toilet after you urinate to empty the bladder more. You can also try double voiding. After you pee, wait a few minutes and try to pee again. You'll often be able to empty your bladder more completely that way. With a rectocele, you may have trouble moving your bowels. Splinting can help. That means while you're moving your bowels, while you're doing it, use 2 fingers to push on your perineum, that's the skin between your vagina and your anus, or place 2 fingers inside your vagina to hold the rectum in place. I know you'd rather not have to do that, but it can help you avoid constipation And besides the obvious discomfort, constipation can be a real problem for prolapse. Pushing hard on the toilet can actually cause prolapse or worsen the prolapse you already have. Problems with sex are common too. A lot of women or their partners are afraid to have sex if a woman has prolapse. Sometimes prolapse can make sex physically or psychologically uncomfortable, but as long as partners keep communication open and follow a few basic safety and comfort guidelines, you can still have safe, satisfying sex even when you suffer with prolapse. For most couples, the fear of having prolapse-related problems with sex is worse than any actual physical problems the prolapse may cause. How bad is my prolapse? Prolapse can be mild or severe. With mild prolapse, you might not even realize you have prolapse at all. When prolapse is mild, the cervix, or the bulge of cystocele or rectocele, is smaller and farther up inside the vagina. When prolapse is more severe, the bulge or cervix goes all the way to the opening of the vagina. In the most severe cases, the cervix or bulge protrudes out from the vaginal opening, not only taking up space in your vagina, but taking up space in your underwear. What about this question? Excuse me. Will your prolapse get worse? If you have prolapse, this can be a terrifying question. The good news is that there's a lot you can do to stabilize your prolapse. You may even be able to reverse your prolapse and reduce or eliminate your symptoms, all without the dangers and pain of surgery. So what do you do now? Do you have to have surgery for your prolapse? Your doctor may tell you that surgery is your only option. In reality, surgery is by far the most dangerous and the most expensive option for treating prolapse. And for up to half of women who have the surgery fails. If your doctor says you need surgery, your first step is always to wait and find out more. And I've got some more great information for you, specifically about how to avoid surgery. Prolapse can be a terrifying problem. You may wonder if it's possible to ever feel normal again. But many women can reduce or eliminate prolapse symptoms, or even reverse prolapse partially or entirely. Even if you're afraid now that you can never again be physically active or enjoy sex or just feel comfortable and normal, there is hope. Just click the link below to find out more about non-surgical prolapse care that can work for you.